Hey guys, this is Stephanie with Empower Physical Therapy, and today we have Melba. And I'm really excited for you guys to hear her story and her whole story, but also the story since she has started wearing these orthotics that we have been scanning people's feet and kind of getting a lot of really good detail and then getting some custom orthotics to our clients. So this is kind of her story. So before we get into the orthotics experience, give us a little bit of your history, your activities that you like to do, and your kind of recent injuries.
I've always been 7 days a week, no excuses to exercise. I used to run, walk, hike, ride my bike. I mean, the whole gamut, and only happy, being physically active. And a year ago in November, I didn't even know exactly what happened, but I was on a horse and my back just completely got, just felt like there was a vice on it. And I continued riding my bike and walking afterwards and just kept getting worse. And finally went to see an orthopedist in January, MRI. He sent me to physical therapy with pain medicine, said, be sure and take the pain medicine before you go to physical therapy. And went to physical therapy. The guy was like, so what have you been doing? And I showed him all the exercises. He goes, oh, you're so far ahead of everybody. You're great. Just keep doing that. And I did. And then 8 weeks later, he told me that there was nothing more that they could do for me. And actually, the pain was worse from what he was doing. And he like literally gave me to a student that was doing a rotation. She did traction on me, which really intensified the pain. So then my orthopedist was like, well, let's do a steroid injection, which, you had to go under,
Anesthesia.
sedation. I mean, it was, and of course, the only thing that I got out of it was a swollen hand from the, where they put the IV, and a terrible headache for 3 days. Nothing changed. And so I just went into a very dark spot. And fortunately, a friend who had been to you suggested that I try it. She called for me. I got it immediately. And, my back, which I literally couldn't walk, I couldn't sit, I was utterly miserable, was on its way to being, fixed with just, 10 minutes after seeing you. So, once the back was settled, then I started having knee problems, but I've had that for over 20 years. And I've just, like taken an anti-inflammatory and kept going and doing everything. But this time it really, got bad. So it's on its way to recovery, with, coming and seeing you. And but it still wasn't 100%.
Yeah, I know we got the machine to kind of scan our feet so that we could really kind of see what was going on. You had a really similar situation to me, in the sense that like that second toe was a little bit bigger than that first toe, which really changes your mechanics. So even with orthotics, you don't necessarily have foot issues. Like I didn't have any foot issues per se. My feet didn't really hurt. Don't have plantar fasciitis. It didn't have any like joint pain. But I was similar to you in the sense that I was getting that knee pain, and it was always on the outside of my knee. And I always knew it was because of the way my foot was, but I could always manage it until I couldn't manage it, until it just was starting to get where it was just being more, it was giving me problems more often. I was not recovering as fast. And it was starting to be nagging. And I'm kind of the same way as you. It's like, I want to stay active. I want to still be able to run or walk or do whatever I want to be able to do. So you were really similar in that instance, even though we'd been working on the knee and we'd been working on the hip and everything was progressing, it just wasn't all the way there. There was still some soreness there. So tell us a little bit. We scanned you, we got the orthotics in, and then tell us like what's happened since wearing the orthotics.
I got the orthotics last Tuesday. I brought my tennis shoes just in case, because I wasn't sure they were. I slipped them in, put my feet in there, and I expected that there would be like some sort of like breaking in period or whatever, but I put my feet in there, and I mean, it felt right.
Yeah.
And it just was like, oh my gosh. And I went out and walked, 6.5 miles, and did not feel any kind of anything other than just like really, really good. And I would say now it's been a week. I just finished walking almost 7 miles this morning. And it seems like every day, it's just, I just feel better. And I did have plantar fasciitis, and I've had it off and on for, oh gosh, like 20 years. And then my left foot was also completely numb for 3 years. And, you all did dry needling on me, and my left foot now is almost, fine. But what I find interesting is that I roll my foot, with a tennis ball a couple of times a day because of the plantar fasciitis. And it's like, there's no pain. I mean, it's like I'll roll it and it feels like the right foot. And I'm just, but it's kind of like, okay. And the exercises that I've been doing, like with the strap, when I lie on my back and move my leg back and forth, I notice that it just seems less tight when I move it, my left leg over to my right. Yeah. And I just feel like I'm able to do the exercises, with less pain, and yeah, it's just getting easier. But I am so enjoying the orthotics.
Yeah. It's what I love about like the report that we get from this is we can really see like the differences between the feet. We can see the differences in the foot drop. So you can see a percentage of like one foot, like the arch being higher than the other foot. Well, that fully can change things. So if you have one foot that's lower, then you're going to have to get that movement somewhere. And that's where like those two bones on the bottom of the foot, they can add some like rotation, which then goes all the way up the chain. So we can look at things from, I always take it from the core down, because we can see we got to get the back moving, and then we get the hip moving, and then we can get the knee moving. But the feet has been a missing component for us, where we can really see what's going on down there, because if there's some issues that we can't really address, we can put people in these orthotics, and that's the results that we'll get. And I was really similar too. Like I put them on, of course, you're supposed to break them in for an hour. Or two the first time that you put them on. Well, of course, I had to run an hour or two. That was my break-in period. But I can tell you, like, my left foot had to have more of a break-in period than my right foot. My right foot's my foot that I always have issues with. And that, as soon as I put the shoe on, I was like, wow, this feels normal. Like, it feels normal. I didn't have any break-in period that I needed for that particular foot. Now my left foot, I did. I was having to adjust it and getting used to it, but I don't really have as many issues from there. But it was very, very similar experience. And I think when we look at orthotics, you don't have to have plantar fasciitis, even though you do. You could just have some issues just going up the chain that could be helped and alleviated. Now I know you got you some flip flops. How do you like your flip flops?
I have them on right now. And that's been so great I got them last Tuesday, and the weather's been so wonderful that when I don't have my tennis shoes on, I've had the flip flops on. And, I just, I just think that they're also adding to the fact that my foot is feeling better.
Yep.
So yeah, I love the flip flops as much as I love, the orthotics in my tennis shoes. So yeah.
That's my next buy. Flip flops. So what would you tell someone that was kind of on the fence of coming into our office? Because I know we operate a little bit differently. So what would you tell them?
When I walk in the neighborhood, especially when people didn't see me for over 6 months, and they're like, oh my gosh, where have you been? I've told them my story. And because of that, I've referred 3 people. Now I have talked to people that are like, well, my doctor said, and you can't convince everybody, because I think people have to, there's some people that just want to be in pain is all I can figure out.
Well, there's people that have to go through their journey. And so doctors hold a lot of clout, and as they should. They've had a lot of education, but a lot of times, because they don't have enough time with people, it's like they spend 5 minutes and they're like, and all they do is view imaging, and you can't base things off of imaging. You couldn't base what we've done with you off of imaging. Imaging didn't help me figure out what we need to do with you. And so when you get people where they're finally at their low point, like that's where you were, you're at your low point of like, I'm ready to try anything, like, because you've had such a bad experience with everything else, then you're ready. But people aren't quite ready when they're like, well, I think this is going to help. And they don't realize like that the surgery that they had maybe wasn't the surgery they needed to have. Maybe they need to have surgery at all. But everyone's on their own journey, and they'll eventually figure that out. And they'll remember when they're like, I'm dying, but I remember seeing Melba and she finally got better. Maybe there's someone that I can, like, I need to go back and talk to her. And just because you've planted that seed could help them down the road.
Yeah, I just, like I said, I was at a point where I felt like I had no hope. And
Yeah.
that's a terrible, terrible place to be in. Before, I always had, kind of low grade pain and aches, and I just worked through it.
Yeah.
But when somebody tells you that there's nothing they can do for you,
Mm-hmm.
I mean,
Yeah.
I,
It's
I
depressing.
yeah, and I don't know how people deal with just the constant pain that I had, because
Yeah.
I couldn't sit, I couldn't walk, I couldn't do anything to get rid
Well,
of it.
and you're someone that wants to be active. There's so many people out there that like they need to be active. That's how our brain like functions. It's how we feel better when we're active, and that's how you were. And so when you aren't like that, then literally it's depressing. It's really
Well,
depressing.
and I appreciated the fact that you validated, me in wanting to be active. And I know that there are a lot of people, especially my friends, they're like, well, this happened to you because you exercise too much. I mean, that tended to be what everybody told me. Well, don't you think, why do you have to do it so long and so often? And I felt really good about finding somebody that actually said, no, this is what
No,
you need to do. This
no,
is
yeah.
this
I
is
mean,
important.
if you can't go and go shopping for an hour or 2 hours, that's like similar to you being on your feet walking and what you're doing, then like you're not living. So we've got to be able to stay active. Our joints feel better when we're active and when we're moving. And it's yeah, it we're meant to move. And the less we move, the worse we get, honestly.
Yeah, but people don't understand that. They feel like, well, I got to rest, so
Well,
no.
because that's what the doctors say. You go to the doctor, and what's the first thing they want to say? Well, you need to rest. Well, you don't need to be doing that. I mean, that's literally what they say. Here's some medications and rest. That's the first
Yeah,
advice that you get. Here's some medications and rest. And honestly, if someone's been hurting for, let's say you've been hurting for 2 weeks, rest isn't going to help it because you aren't even sure what you did to get to that point, which is what the majority of the people are. So rest is not going to help you. Now, if you're a kid that's 12 years old and you got hurt, rest and you heal fast, 2, 3 days later, you may be fine. But as we get older and we have pain longer than 7 days, rest is not going to help you. You'll feel better and then you'll get back to your activities and then it hurts again because you never really resolved what was going on in the first place. And that's where you have to get to people that can really sit down and figure things out. And our body has an amazing ability to heal if we give it the right environment, if we get to the source of the problem. And that's the problem with our healthcare system, is that we don't get to the source. It's like we just look at imaging and we just want to throw pills at people and we just want to do injections. We don't want to figure out, well, wait a second, where is this pain really coming from? And I always tell people where the side of the pain is often not where the source of the problem is coming from. And there can be multiple things that need to be looked at in order for everything to kind of work properly. Like for you, like the knee, we've looked at the hip, we've looked at the knee, now we're doing the foot. And it's the combination of everything that's getting you back.
yeah. But I just, like I said, you've been a wealth of information, and, looking at my MRI, with a bulging disc and entrapped nerves and a fracture, and, you fall apart when you look at that.
Mm-hmm. Well, and that's the biggest fears when you go in and you see all these things on these imaging. It's like, well, how do you fix this? And there's not people spending the time to give you the education to go like, listen, this is where you are. This doesn't make sense for this, or this does make sense for this, but it's totally fixable. And this is how we're going to do it. And really taking people through that journey and giving them education as to what's going on, why it's happening, what you can do that's giving you the problems, and then giving you education as to like why it's happening. What are the things that you're doing throughout the day that we could that could be causing some of the problems as well. So it's just education. Education empowers people.
Yeah.
Well, awesome. Well, thank you so much. I love your story, and I'm so glad that you're getting back to walking and hopefully cycling here pretty soon. I haven't heard about that, but we should be getting you back to cycling here soon as well. And I'm so glad the orthotics are doing so great for you, because I know that's what it did for me. So I'm excited for other people to have really similar experiences. And it's just another tool for us to be able to help you guys.
Yeah, it's been great. Like I said, I couldn't be happier with the orthotics. So thank you for doing that.
No problem.